Hi, everyone. Excited to be here. Thanks for joining. Today, we'll be going over opportunities and challenges in healthcare and machine learning. And I would love to talk with all of you and answer any questions. Please do save those questions for the end. Feel free to put the questions on the chat, and I'll get to it at the end. So just a quick bio. My name is Pruksachatkun, and I am a machine learning researcher specializing in natural language processing, which is machine learning applied to text data. I've had the opportunity and honor to work on various healthcare-related research projects in corporations and startups such as ASAP and Microsoft Research. This talk is a creation of things that I wish I had known a few years back, starting off as a machine learning enthusiast who wanted to help make an impact in healthcare, and as well as some overview of what other people have done and research going on in the area currently. In terms of what we're going to cover, we're going to be looking at ML applications to hospital systems and public health, mostly in the US, and going over some barriers to use in deploying these algorithms out to the wild. What we're not going to the basics of machine learning, since there's so many amazing resources out there for you to look at. We're also not going to be looking at genetics data. And since I am not a clinician, I will also not be saying where machine learning should be used, since that should be for clinicians and hospital workers to decide. Since I'm also not a lawyer, I will also not be going into the legal regulations of machine learning, although there are some really cool questions to be asked there about whether or not it should be considered a medical device. So one thing that I wish I had known a few years back, starting off, and I wish I had internalized, is that machine learning cannot and should not replace physicians. Whether that's, there's a lot of interest and efforts that are trying to do this to some extent, including chatbots that in mental health that try to help calm someone down or help people get connected to resources or try to provide therapy for people. Although these efforts are really great, there's so much complexity in healthcare, and there's so much complexity to the human body and mind. And machine learning is still so far away from being able to have the understanding and have the reasoning skills to be able to connect the dots like what physicians do. So TLDR, there's still a lot to be done. And we should not and cannot right now replace physicians with machine learning. So what areas have machine learning researchers already tackled in healthcare? The first is in computer vision, which is machine learning for image data. And here there's been a lot of promising gains and models being developed in terms of radiology and breast cancer detection. In fact, in some of the recent studies, researchers have created models that have been able to match or even slightly exceed clinician and human annotator performance in those data sets. On a separate note, well, separate but related note, is diagnosis. There's a lot of interest in terms of, given the electronic health data of a patient, of predicting diagnosis for that patient. So this is from both in computer vision and also in natural language processing, taking in the lab results and previous patient notes and predicting the diagnosis for that patient for this current visit. Along the two areas of interest has also been this interest in clinical task automation. So automating all of the administrative tasks that physicians have to do, whether that's prescribing medicine or writing down patient notes, or for hospital workers filing reimbursement claims, all of those tedious administrative work that has to be done to keep the healthcare system running and to provide value for patients. So there's been some effort around this to help make that smoother, whether that's summarizing patient notes or adjudicating problem lists. Now, switching over to the public health side of things, there has been a lot of effort in machine learning to address public health concerns in the digital era, online, in social media, in places like Twitter and Wikipedia, where there has been algorithms that have been developed to detect anxiety and depression, as well as toxic language and hate speech. With the current pandemic that we are all going through, there has also been a huge influx of interest in terms of surfacing the most prominent and informative research papers to do with the coronavirus for COVID-19 scientists. And in fact, there is a capital challenge that was created by the White House in conjunction with prominent AI companies to help draw the talents of machine learning engineers and data scientists to this cause. So there's definitely been a lot of potential and a lot of work around using machine learning to help make the digital world and digital public health better. Now, given that there's a lot of really awesome things happening, let's go into what are the challenges to actually deploying those algorithms into the real world. The first is explainability. If you're a clinician and you have this model, even if this model is 100% perfect, 100% accurate in the data set, and it was trained to predict diagnosis, would you trust a model that just, you fed the patient notes of an income of a patient to this model and it outputted some predictions of what the patient might have? Probably not. And there actually has been a study that has shown that explainability is so important for creating trustworthy and deployable machine learning models. And so this is one area that is so important, especially for these black box models that have been shown to start to increase performance in healthcare problems. The second is bias. Now, to explain bias, I'll start with a hypothetical, or not so hypothetical situation. Say you're an insurance company and you want to identify patients that have that would benefit most from a high-risk care management program, which basically means that they are able to be put into closer monitoring and also have higher priority for primary care visits. So you develop this model and this algorithm, and one of the features that you might think would be a good idea to use is the previous healthcare cost for patients. Now, that makes sense, right, from the first thought, because if a patient has high healthcare costs, it means that they probably are chronically ill or they had some serious conditions in the past that have made them have to go through intense, expensive care in the past. And so those patients would most likely be more likely to need to be admitted into a more intensive care program again. So in first glance, it might make sense. But there has also been some studies, and this study that has shown that some demographics are actually discriminated against in this system, because some demographics, even if they have the same amount of symptoms as someone else, will be put at a lower risk level, and so will not be given as much care as another population. And so their healthcare costs would be lower, but that doesn't mean that they're just less sick in general. It means that they were, unfairly treated beforehand. And this is very dangerous because if this model is deployed into the wild, this model will only perpetuate these racial differences and discrimination. And there's so many factors and variables like this, like latent variables that can cause a model to become biased based on race or based on gender or so many other factors. So it's very important to make sure we get this right. The third thing, but of course not the only three, is generalization. Models that are very good at overfitting and training to one distribution. But studies have shown that if you trained a model on past data, even like 2 years ago, in patients who came in 2 years ago, those models would do a lot worse on patients in the current time frame. Or if you have a model that was trained in one hospital, it wouldn't be able to generalize to another hospital. And this is a huge problem in terms of making sure that these models are easy to adapt for hospitals. Now, now we've just covered 3 of the biggest problems, although there are so many other problems in terms of deploying machine learning models to healthcare. What can we actually do? Now, this is more suggestions for people who are engineers or researchers who are interested in helping pave way in healthcare. First is thinking about how to improve annotations. One of the first things you learn in machine learning is that your model is as good as the data. So we really need to understand how best to annotate data for the healthcare context to yield high quality data. Second is improving access. Given the privacy concerns and given the very sensitive nature of healthcare data, how can we ethically improve access, and also, which is so important in terms of helping create these models. And third is what I had gone over before in terms of creating models that are better at generalization, explainability, and bias. Now, I would like to leave you all with a thought and finish with a thought. Looking back, and I wish I had known this before and really internalized this a few years back, one thing that is so important to keep in mind is that machine learning can do no good without healthcare specialists. This is because healthcare, at its core, is a human problem. There is no move fast and break things in healthcare because lives are at risk. And there is so much potential in machine learning to make an impact and pave innovation in healthcare. And we just need physicians by our side to do so. That's it for today. Thank you very much. I will now take a look at the questions. All right. So, okay, cool. So many people from so many places. Let's see. Rashi asks, what algorithms do you use most of the time? So I specialize in natural language processing. So this is not, so basically machine learning for text. And right now I've been using more transformer-based models. I can link after this talk to an overview of transformers and BERT, which are current buzzwords in NLP. But there's, for computer vision and other text machine learning, there's other famous algorithms that are being used. Okay. Asta says, how would you recommend first getting involved in machine learning and healthcare as a college student? I would say reach out to your university, to professors. If there's a professor in computer science or even a professor in the medical school, I know there's at NYU, for example, there's a lot of overlap between the two. So definitely reach out to those people. All right, and Ibokun says, when you started out in machine learning and healthcare, did you have subject matter expertise in healthcare? No, I did not. And this is why it's so important if you're an engineer or if you're a machine learning researcher to partner with physicians. Because there's definitely some people who first got a medical degree and was a doctor and then switched over to machine learning, but those people are very few. So usually in these types of research, you have a lot of people from different areas of expertise together. Any references to how, oh, okay, sorry, when something just bugged out. Okay, here we go. There's a lot about references to how machine learning is helping COVID-19. Yeah, so I had referenced the Kaggle competition about COVID-19. So I'll actually put a link here later after this talk. But you can also just Google COVID-19 Kaggle challenge and you'll see all the solutions of people who have participated in that. Okay, okay, Lazali says, do you see yourself obtaining some medical experience? Yes, actually, I have personally thought about, and I'm still thinking about maybe going into getting some more formal training, especially in terms of counseling and clinical psychology, because that's actually where I'm most interested in is mental health. Okay. Maria asks, how to get into a machine learning startup or AI startup in healthcare as a medical MD graduate. I would say just reach out to them. Like a lot of these AI startups are eager for experience and for talent, and reach out to healthcare AI startups. And lastly, I see a question about where to start in machine learning. So there's a lot of, there's so much data and also a lot of courses out there. If you're interested in natural language processing, there's actually one textbook that's online and free that I would really, really recommend. It's by Kyung-Hyun Cho. Let me just type it out here. Kyung-Hyun Cho. Kyung-Hyun Cho, he's a professor at NYU Center for Data Science, and his book basically goes from the basics of machine learning and what it is to pretty state-of-the-art in natural language processing. And it's very enjoyable to read. So I would definitely Google it and check it out. Rashi asks, what platforms would you recommend for ML practice other than Kaggle? Colab, I would say. It's kind of, in terms of practicing machine learning, I would say the best setup is to actually look at open source tools and just try to implement a machine learning model yourself. Or you could just try to replicate a result. So you don't have to actually code anything from scratch. Just take the code that a researcher has made, git clone it, and just try running it and understanding how it works. And I would suggest actually using PyTorch for all you machine learning newbies out there, because TensorFlow is kind of a pain. And Erica, yes, would love to connect. Cool. Do you guys have any other questions? I know we're going to be kicked off of this platform soon, so I'm going to actually try to get the COVID-19 table here in the links for people to see. Let me just put it here. All right. And I'm glad you guys had found this informative. And Sakshi, what advice would you give someone entering NLP? What skills are most in demand? I would say it depends. So there's some very specialist types of roles, like for research type roles, but those are quite few. And a lot of times, if you're looking at data science positions in NLP, you don't need too much in-depth knowledge. Like I think bag of words and having a solid grounding in statistics is pretty good for a lot of positions. Cool. Thank you all for joining. And I hope we can connect. Definitely feel free to reach out to me on LinkedIn. I think there's like a LinkedIn post somewhere on the speaker presentation. And yeah. All right. In that case, I will just leave it from here. Yeah, hope to talk with all of you soon. Bye.